Welcome to One ABQ and You. Conversations, culture, and community. A City of Albuquerque production with your hosts, Mayor Tim Keller and me, Leah Black.
This episode was taped when Mariela Ruiz-Angel was the director of the Albuquerque Community Safety Department. Since production, she has been promoted to Associate Chief Administrative Officer for the City of Albuquerque. Hope you enjoy the show. Hi, I'm Stacy Dringmeister, filling in today for Leah Black. We have a great show today. We're excited to be talking about one of the most incredible things happening in our community, the Albuquerque Community Safety Department. So, Mayor, I'd love to hear from you. Tell us about how this all got started.
Well, it's a very interesting story. First off, glad you're on. So, Stacy, welcome to the show.
Thank you. Thanks for having me.
Yeah, I never get to see you, so this is such a treat. We started this department in the midst of two things: the pandemic and the sort of summer of social justice and the murder of George Floyd. And what, in summary, what it is, and we'll hear about it from Mariela, is it's really an alternative response to emergencies, which also makes it alternative policing. So it's this notion that when you call 911, when you call 911, like, we should have an answer besides police and fire. And they should be like social workers and behavioral health specialists. And this department is now real. So what a lot of people, may not even know is that Albuquerque actually has this 24/7. They take literally like 60,000 calls last year. And so it's one of the areas, I wish we could say this more about things, but this is one where it's true. It's not like politician talk. We are the most innovative in the country on this issue. And so we're excited to share it with everyone today. And also, Mariela is an amazing story. There's no way this department would exist without her, like, as a person and as a leader for our city.
Well, I have heard, 911 for the past 50 years, police and fire. So for Albuquerque to have now an R911 system, this alternative response is really groundbreaking. And I think our local community, we take for granted. People said we couldn't do this.
That's true. The whole country said we could do this, let alone our own town. And it's one of those examples, I think, of, we like to believe that Albuquerque is a little bit different than everywhere else. And I like that. That makes us unique and special. And I think it's true. And sometimes it works kind of with helping our city, and sometimes it works against, we can resist some things that might be helpful. But in this way, I think almost no other city could have pulled this off, because I think we also have the sort of connectivity, the one Albuquerque spirit that we need, but we also had the right leaders in place at the right time that were already here, even at the city and at Albuquerque. But also, our community during the pandemic did something most communities didn't do, which is they just gave us a chance to help. So, even for myself, like, I have never felt a more sort of opening invitation to just try and do what you think is best than during that time. And this is what we thought would be best. And we couldn't have done it if the community didn't say, like, they were kind of like, I don't know, let's see. Good enough. And now we're seeing that it's really worked. But in other words, that opportunity and that sort of license to try something, that came from our city, from our community.
I love it. Well, looking forward to talking more about it with our guest. Well, here to join us today to talk about this amazing new department and get into some of her history is the director of Albuquerque Community Safety, Mariela Ruiz-Angel. Thanks, Mariela, for being here.
Hi there.
So just a super quick summary. What's ACS and how's it going?
So ACS is a third branch to public safety. So when you call 911 or 311, you'll get a firefighter, a police officer, and since 2021, you'll now get a behavioral health responder. So it's really about, right, I think our tagline that I think many cities are now picking up on, it's about the right response at the right time. And so it's been going great, almost so great that we did not anticipate that it would catch on the way it did. I think we have taken now over 60,000 calls for service, which is a little bit about 5 to 6% of 911 calls. And just to give you perspective, fire takes about 13% of 911 calls. So we're up and rising. And a big part of what ACS was about was diversion, right? We know that our police have been strapped for so long, and we're in this really cool space now in our community and nationwide where we're realizing, like, we can be doing more to support them. And I think part of that is bringing this amazing lens of behavioral health and mental health so that they don't have to go to these calls that, one, they're not necessarily trained for, but two, that aren't black and white, right? There's a lot of dynamics when it comes to mental health. And so we're in this really amazing place where we're filling the need and the gap. And we're booming enough that, like, I think we're having to really think about our growth strategies. So it's been really exciting to be a part of this.
It is amazing when you look at how young the department is, and those numbers that you're talking about and the work that you're doing is just phenomenal. We'd love to hear what some of those calls are like. I think when we hear this third branch of community safety, it'd be awesome to have you tell the stories so we can really understand what those calls look like.
So when we first started, we always knew we wanted to take kind of low to mid acuity calls. Calls that really would hold police up in a way that was just kind of long and lengthy, and that always almost ended up in like the same situation, walking away, or unfortunately escalating, and then it might end up in a worse situation. And so we typically will take, in the first couple years, we saw a lot of calls on homelessness and a lot of welfare checks, very kind of, my mom fell, we don't know where she's at, can you go check on her? Very kind of simple things that you would see, but again, calls that might sit for 2, 3, 4 hours, just because we had a lot of calls coming in for 911 and they weren't necessarily the top emergency when we think about emergency calls. So those are kind of our typical, very day-to-day. But what we've really seen over the last probably 6 months to a year is this uptick in high acuity calls, which is where we really wanted to be. This was the call that somebody might want to hurt themselves, whether it be because of, they want to do suicide by cop. That's a big one that always goes really badly for police. We are now starting to see this really cool partnership with police saying like, hey, we got this call. We probably shouldn't be going to it. Can you go in first? We don't see any major like weapons or areas that we think would put you guys in harm's way. And they're coming out really strongly. So we just went to a call last weekend, actually, where somebody who was a repeat caller, and it's never a good turnout whenever police comes out. And we went to it and had this amazing opportunity to work with this young man who lives with his parents, who's dealing with co-occurring illnesses. And it was like it was just exactly how we planned it, right? Police called us out. They were like, we're here if you need us, but ultimately, we're going to give you guys space. And we were able to walk in, not just talk to the individual who was dealing with these ideations, but also talk to his parents, because this is something that's been really weighing down on them as well. And so ultimately, we were able to get this man into treatment and get him to be able to have now a functional life. So he is now on medication and is able to be a lot more sustainable and calm in his mental health journey that he's dealing with. And the parents have reached out, which has been really cool to see, like, hey, this is the first time we had an experience like this with 911 that we'd never had before, and we love it. And can we follow up? Like, can we maybe we'd love to hear more about other things you guys can offer as well. So that's one of the many calls that we kind of get for service. That's really about how we're changing the system of care around our public safety departments.
So this for folks who are less sort of they fortunately haven't really had to dive deep down, like what is behavioral health and what is ideation, and even terrible things, but things that are real and we need to talk about, like sometimes people call in with the suicide by cop and things. Mm-hmm. Give us a sort of the bookend example on the other end, where it's sort of something a little more routine and all, but again, like, you don't need a police officer.
Yeah, I mean, that's the, I hate to say like the bread and butter, but it is the typical call that we get, which is really about, I'm really feeling depressed right now. I don't know what to do. These are just feelings I'm having right now. And honestly, you get this a lot from seniors who are going through their changes and who are also kind of figuring things out for themselves. So we get out to a lot of those calls, and a lot of our calls are about having a conversation, right? A lot of times people just need somebody to talk to. And then during those conversations, we can really have a better understanding of what their situation is and how to really help. And so it's really about trying to de-escalate folks to then kind of meet them where they're at and ultimately figure out if it's something that is at a heightened level that we need to have, hospitalization, or if it's something that we can really kind of maintain, right? This really helps us with what we call familiar faces, right? We get a lot of calls from the same people over and over. And typically when police have gone out, they're like, hey, there's no big issue, and they move on. But now we can really spend the time that we need to with some of these folks so that hopefully they're not going to call 911, 20, 30 times. Those are typical calls. We also get a lot of calls from parents. Right now, mental health amongst our youth and young adults is really in the rise, and a lot of parents are not equipped, nor do they have the understanding on how to handle that. So we get a lot of calls around my kid's having a crisis. I don't know what to do. I'm worried he's escalating. He's saying words and comments that I don't understand. And so that's where our teams have been able to go in and really just meet with the family and have a little bit of a better conversation about how we can truly help. And in some cases, which is what I love, is that typically a call might sit for a few hours, unfortunately, if we didn't have ACS. And so what we're finding is that finding this person before it escalates to an even bigger crisis is what's really helpful, right? That hopefully really takes that high acuity down to a mid acuity, right, in regards to the emergency level. And that's what we really want, is these calls that are kind of like in this very beginning stages. This is where ACS has really been able to fill the gap. And we're seeing the numbers, right? Even since we've started ACS, and now we've had a 50% growth due to the commitment of our administration and city council and our community with more responders. We've had an 85% increase in our calls. And so what that means is that we can get to more people, but we're also seeing that calls that normally might take an officer a couple hours has also decreased. So then those call volumes have seen wait times have gone down as well. It's like about an hour and a half is what we're seeing. So that's even a bigger win for the entire community, because not every call is for ACS. And so we want to acknowledge that we want to keep our police as free as we can so that they can really hit those harder issues.
Just awesome. It really shows too that the interconnectivity of so much, whether it's behavioral health, but also like first responders, but also how we what we do in a crisis, like we call 911 or we do whatever. And you're hitting so much of that. It's amazing. It's like this healing ointment on so many wounds, in our community.
It's therapeutic. I mean, it really is. And I find that our teams and even city, we have a big, very large city population of city workers. And we even see that sometimes they'll call and be like, hey, I have this distraught employee and I don't even know how I should handle this. And so it's really cool to be able to start seeing normalization of behavioral and mental health in a way that doesn't have to be taboo or
like an ambulance.
Yeah, it has to be some big ordeal. It's we can really hit this in a way that allows for community to still feel safe, but not have to have this ordeal where cops and ambulances are at their house and making a big scene. So I think that that's been really cool. But I will say we're the new kid on the block, and so cities across the nation are picking this up, but part of being the new kid is also figuring out how to figure out all the challenges, right? We're also
Speaking of new kid, we should find out how, because you're kind of a new kid in a sense. It's not like you trained your whole life for this job.
Yeah, I know.
No, I'd love to hear about your background, but then also for everybody listening, how you came to ACS, is that similar to how the responders came to ACS? Because there's not a blueprint or a model. This is something brand new. How did you get here, and then how did your team get here?
Well, my previous job here at the city was starting our Office of Immigrant and Refugee Affairs, OIRA. And although I did that for a couple of years, it wasn't until we hit the pandemic that I realized myself and other social workers and other kind of community workers were in the trenches working with families, right? Because nobody's supposed to come out of their house. We were all supposed to be bunkered down. And so what, I found myself was getting people resources, finding out how to get people food boxes and appropriate food boxes, right? At the time we were working with lots of refugees and large families. And so part of that was how do we make sure that they have all their needs met? And then when we finally had a vaccine, it was figuring out how to get that to them, right? That was such an essential piece to coming back to life from a really awful pandemic. And it was during that moment that I was like, man, this is frontline work. We're seeing social workers and case managers and counselors get out of their comfort zone, which at the time was very more traditional in their office, waiting for people to come to sit down in front of them and do an assessment. And instead we were seeing it out in the field. And I thought, this is it. This is the evolution. As a social worker myself, this is not taught like this. We teach a lot of really cool techniques around rural social work and going out to homes, but it's nothing like this. This is very different. But I found that myself as a social worker and then others that I was working with were really interested in this work. One, because it took away the having to sit down, schedule an appointment, wait to see if that person was going to show up, wonder if they're okay. And then, unfortunately, in a lot of situations, if they don't qualify for a certain, Medicaid, or if they don't have a certain level of acuity, you can't serve them. And this doesn't have any of those barriers. This is like wherever you're at, whatever your situation is, we're going to figure out how to help you and get you to the right location. And so it was kind of a sexy, kind of product that we were saying like, hey, if you're interested in this, let's do this. And it was surprising the amazing, when we put those few positions together, we had 500 applicants. I don't think I've seen that anywhere in private or public sector type of work. And so it made me realize there's such a need for people who want to do this. And what we've also found was there was other type of frontline workers, such as nurses and even ex-police officers, right? People who had already left the police force or the fire force who wanted to still do something cool, but not necessarily be in police and fire. And it's been a really amazing journey for me in this work. I never thought I'd be doing this, and I'll never forget the day the administration called and was like, we don't know what this is going to look like quite yet. We got some ideas, but do you want to do this and help figure this out? And you got 3 hours to make a decision. And I was like, I remember thinking, if it's not me, who will it be? And I just felt like I felt really compelled at the time. And maybe it was the pandemic and wanting to do good. But maybe it was also just feeling the heightened sense of watching community really needing something more than just our typical response. Right, really wanting something. And this was also the birth of 988 and other types of work around the nation to try to address this. And we were doing it, so it wasn't like we weren't part of something prior to this, but never at this level and never in this kind of bold and innovative way. So,
well, yeah. It really is. It seems like you and your team and everyone involved, just this desire to help and meet people where they are. I know, recently we've been highlighting the work with street medicine and your responders going out with physician assistants, meeting people where they are for their medical needs, meeting people where they are in their homes, like you said, if it's a mental or behavioral health call. It's just amazing, and would love to hear too for you any reflections on where you are now, considering you have been an integral part of standing this up as a young woman leader at the city.
I'm always a little bit in shock, I will say. I think when we first started this, we were always we'll get to 200, maybe 300 people, but there's a need for it now. I think that was the hope, but now seeing the numbers, getting calls from residents that are just this is amazing. You came to my house and you helped me with this, right? And we are seeing in a lot of situations, people who have just been fearful of working with police officers or even paramedics and firefighters who are now more willing to work with them, knowing that we're a bridge to them. And I think that's what this is about, right? Our vision and mission was always about bolstering the current system in a way that really needed to feel safe for community. And I think this has really been the golden ticket. And I'm really excited about the potential growth, right? We haven't hit this leveling yet. I keep waiting for a plateau, we're going to hit this number and then it's just going to stop. And every month it just keeps getting more and more. I think at the time we had projected that maybe by 2026 we'd hit 4,500 calls a month. We're almost at 3,800 calls a month in just 2 years. So the need is great. We're just excited about the growth. I think everybody is. There's just this really amazing kind of vibe, especially as we bring in some new classes and everybody's not as new. Every year every month I'm always more impressed with people who are coming on board and who are just really down for it, right? This is my job. I want to have a career in this. I want to be a part of this. They're all prepared for the next emergency. We're now aligned with police in regards to how we take calls. And so we'll hear a lot of these kind of big, sometimes issues that are coming up in the community. And my team's always do you think we should go out there. And I'm like, only if we're called. Like, it's okay. Like, but everybody's always wanting to like jump in and help out.
You're doing like snow plows.
Yeah, like everybody's
yeah.
like when we had that small little like storm the other day for, as it snowed. I mean, I got multiple calls that morning like, we're going to start calling more people and we just have to figure this out. And I was just like, okay, cool. Like, this is a really cool thing to watch people really be enthusiastic about this and also feel really needed. Like, that's a big part of this, is that I think motivation is, because we get a lot of calls that sometimes it doesn't always turn out right? That's just the job, that sometimes we're just like, man, I really wish that person would have taken this service, or I really wish we could have done more. And that's part of the job. But then there's these other calls that are just when we get that domestic violence, and it may not even come in as a DV, right? It might come in as like a disturbance. And so we show up and then we find that it's something bigger and we can really help people. And so those are the kind of calls that my team walks away being like, we did that. Like, we helped that person get to that situation into a better place and a safer place. So the motivation is there from folks, and I'm really proud of the many people who have really shown up. And I'm really proud. I think one of the hardest things that people from nationwide, even worldwide, were concerned about was the reaction that we'd get from fire and police. And I think, as anything new, we had a little bit of rub in the beginning stages, but to hear, even just as I'm on the radio, sometimes I'll hear fire and police be like, hey, let's meet for breakfast after shift, like, let's all get together. There's now this really cool mutual respect for what each of us does in a way that is just really beautiful, to just say the least.
Well, we should do more episodes on this. We're at about our time, but I think maybe just Sherry, what I love about hearing you talk about this department is like, I think there's fundamentally a belief that some people still have, clearly myself, that like government can actually make a difference. And I think that is a statement that applies obviously to our community, to helping our community, but also to the people who work in government, right? To the thousands of people who sign up because they want to actually help. And like in your department, it's all true. I mean, and that is just awesome. And so, I think you're reviving a lot of things, including our own workforce's just belief that we're lifting up the city, and also the city's belief that we're there to help as the City of Albuquerque government. So thank you.
Thank you.
Thank you so much for being on today. And just want to second Mayor, we'll have to do another episode with you again. Was glad I could fill in for this one today.
I look forward to it.
Thanks so much for having me on. Looking forward to seeing you all again next time.
Thank you all for listening, Albuquerque. And remember, it takes all of us to fulfill the promise of the city that we call home. We're going to see you again next time on 1ABQ and You.
Be sure and subscribe wherever you get your podcasts, and follow us at #1ABQandYou. If you'd like to share your own ABQ observations, experiences, or topic suggestions, reach out to us. You've been listening to 1ABQ and You.